Hi, today we're going to be discussing chapter 3. So I'm going to go ahead and share my screen and we will go ahead and get started. Okay, so chapter 3 is the skeletal system. Let's kind of take a look at the structures. These are the combining forms within the chapter, your new combining forms. Bones is osi, osteo, and osto. Bone marrow is myelo. This also means spinal cord. Cartilage is chondro. Joints is arthro. Ligaments is ligmento. Then you have synovial membrane and synovial fluid, both mean the same related combining form, synovio and synovial. And then bursa is burso. So structures and functions of the skeletal system. So it does consist of bones, bone marrow, cartilage, joints, ligaments, synovial membranes and fluids, and the bursa. The functions, the body system has many important functions. The framework of the body. They provide support and protection to internal organs. They provide wide variety of body movements. They store it, their storage of important minerals, and then the red bone marrow located in the spongy bone. Formation of the bones. Ossification begins after a 3 months gestation and continues through adolescence. The growth of bones continues through the action of osteoclasts and osteoblasts, repairing minor damages and fractures. So the osteoclasts break down older damaged bone, and osteoblasts help rebuild the bone. The structures of the bone. Bone is the second hardest tissue in the human body. Only dental enamel is harder than the bone. We have types of bone. We have the periosteum, which is a tough fibrous tissue forming outermost covering of the bone. And looking at that medical term, we can break that term down. Peri is surrounding, oste is bone, is noun ending. And then we have a compact bone. This is the dense, hard, strong bone forming protective outer layers of the bone. We have a spongy bone. This is a porous, thus more susceptible to fractures. We have medullary cavity. It's the center of long bones. This is where storage site of red and yellow bone marrow is. And then we have the endosteum, which is, this just lines the medullary cavity. You can see that this figure here is the tissues of the bone. Although it is a dense and rigid tissue, bone is also capable of growth, healing, and reshaping itself. This figure here is just the anatomic features of a typical long bone, and you can see here the bone here. Next, we have the bone marrow. So we have the red bone marrow and the yellow bone marrow. The red, then you'll find, is located in the spongy bone. It partially replaced by yellow bone marrow during adolescence. And then we have the yellow bone marrow. This is where fat storage and long bone medullary cavity is found. Next, we have cartilage. This is a smooth, rubbery, blue-white connective tissue acting as a shock absorber. It is obviously more flexible than the bone. We have the articular cartilage. This covers surface of articulation joints, and this allows smooth joint movement. Then we have the meniscus. This is the curved fibrous cartilage in some joints. Here's a figure of the cartilage. This figure here is the major ligaments of the knee. This anterior view of the knee shows the complex system of ligaments that make its movements possible. Next, we have anatomic landmarks of the bones. The first one we have is diaphysis. This is the shaft of the long bones. Then we have epiphysis. This is the wider ends of the long bones. So we've got two, we have proximal and distal. Proximal obviously is nearest midline, and then distal is furthest away from the midline. We have a foramen. This is the opening of bone allowing passage of blood vessels, nerves, and ligaments. And then the process is just the projection allowing for the attachment of the muscles or tendons. Joints. Joints are also known as articulations, and they are a place of the union between two or more bones. They're classified according to construction or degree of movement. We have the fibrous joints, the inflexible layers of dense connective tissue is what those are. They hold bones tightly together. They're also known as sutures, and they do not allow for movement. In newborns and very young children, some fibrous joints are movable before they have solidified. We have the cartilaginous joints. These consist of bones connected by cartilage, obviously. They allow slight movement of joint. Example, where the ribs connect the sternum to the breastbone, these joints allow movement during breathing, where you'd find these joints. Next, we have the synovial joints. This is just the articulation of joints permitting a variety of movements. They are described on the basis of the type of motion, and you can see what falls under that would be the ball and socket, and then the hinge joint. Ball and socket, such as hips and shoulders, and then the hinge joints would be knees and elbows. And you can see here the synovial joints. Here's your hip joint, the elbow joint, and then the knee joint. Components of the synovial joints, we have the synovial capsule. This is the outermost layer. The synovial membrane, this lines the capsule. And then we have the synovial fluid. This is just the lubricant allowing for smooth movement of joints. We have ligaments. These are fibrous tissues connecting one bone to another bone. We have the bursa, the fibrous sac acting as cushion, just easing that movement in areas subject to friction. Next, we have the skeleton. We have the axial skeleton. Protects major organs of nerves, respiratory and circulatory systems. In the human, the axial skeleton consists of 80 bones of the head and body that are organized into 5 parts. So you can see the 5 parts: bones of skull, ossicles of middle ear, the hyoid bone, rib cage, and vertebral column. We have the appendicular skeleton. This protects organs of digestion, excretion, and reproduction. And this is organized by upper extremities and lower extremities. The upper extremities are the shoulders, arms, forearms, wrists, and hands, and the lower are the hips, thighs, legs, ankles, and feet. The bones of the skull. The cranium has 8 bones, base 14 bones, and middle ear has 6 bones. Here's the figure here. This is the lateral view of the adult human skull. So you can kind of see where these are all laid out at. Here's the anterior view of the adult human skull. You can see here with the frontal, orbit, mandible down here, maxillary, nasal bone, and temporal. Bones of the cranium then, the cranium, C-R-A-N-I, skull, U-M is noun ending. We have the frontal bone. This forms the forehead. And then we have the parietal bones, forms most of the roof and upper sides of the cranium. Occipital bone, this is the back part of the skull and base of the cranium. We have the temporal bones. This forms the sides and base of the cranium. We have the sphenoid bone, makes contact with all other cranial bones. This is that wedge-shaped bone at the base of the skull. Isthmoid bone forms portion of each orbit. It does separate nasal cavity from the brain. The auditory ossicles, we do have 3 tiny bones, and it's located in each middle ear with the malleus, incus, and stapes. Bones of the face, we have 2 nasal bones. These form the upper part of the bridge of the nose. We have 2 zygomatic bones. This articulates with the frontal bone, and then we have 2 maxillary bones, which form most of the upper jaw. So the face is made up of 14 bones. We have 2 palatine bones. They form anterior part of the hard palate of the mouth and the floor of the nose. We have two lacrimal bones, make up part of the orbit at the inner angle, and then the two inferior concave bone just forms part of the interior of the nose. So it can be pronounced conque or concave, I guess. Bones of the face, the vomer bone forms the base of the nasal septal, and then we have the mandible, and that's the only movable bone of the skull is the mandible. Thoracic cavity, also known as the rib cage. This obviously protects the heart and lungs. It does consist of the ribs, sternum, upper portion of the spinal column, extending from the neck to the diaphragm. Costals, looking at that medical term, we can break it down. Cost is rib, AL is pertaining to. So there are 12 pairs. They attach posterior to the thoracic vertebra, and they're also true ribs. The first 7 pairs are true ribs attached anterior to the sternum. We have false ribs. These are the next 3 pairs. They attach anterior to the cartilage that connects into the sternum. And then we have the floating ribs, and those are the last 2 pairs. They are not attached anteriorly. Here's, you can see the anterior view of the ribs, shoulder, and arm. So here's the clavicle, scapula, sternum, costal cartilage. Here's your ribs, humerus, radius, ulna. Here's your thoracic cavity. Xiphoid process is this little nodule here. So the sternum is a flat bone located in the middle of the chest. There's 3 parts. The manubrium forms upper portion of the sternum. The body forms the middle portion. And the xiphoid process forms the lower portion of the sternum. Shoulders, the form pectoral girdle supporting arms and hands. Clavicle is also known as a collarbone. And then we have the scapula, which is the shoulder bone. The acromion is extension of the scapula, forms high point of the shoulder. And the arms, we have the humerus is the upper arm. Radius is the shorter bone in the forearm, the smaller one. The ulna is a larger, longer bone of the forearm. And then we have the Ohlkarian process is a large projection on upper end of the ulna. Wrist, hands, and fingers, we have 8 carpal bones. This forms the wrist. We have 5 carpal bones, form the palms of the hand. We have 14 phalanges. These are bones of the fingers. 4 fingers have 3 bones, and thumb has 2 bones. And here's a figure. This is a superior view of the bones of the lower left arm, wrist, and hand. So you can see here, here's your phalanges, metacarpals, carpals, the ulna, the radius, distal phalange, proximal, and singular metacarpal. Phalanges here, metacarpals and carpals. Okay, next they talk about the structure of the vertebrae. So the body is the anterior portion. It's a solid to provide strength. The lamina is the posterior portion, and the vertebral foramen is open in the middle of the vertebra, allowing for passage of the spinal cord. And let's take a picture. Let's take a look at this here, this figure here. These are characteristics of a typical vertebrae. So you can see the lamina here. Here's your body. Here's the foramen. Transverse process. Anterior, posterior. So let's take a look at the types of it. We have the cervical vertebrae, set of 7, C1 to C7. This forms the neck. We have the thoracic vertebrae, set of 12. So that's T1 to T12. And then this is also where a pair of ribs attached to each of those. We have the lumbar vertebrae. This is a set of 5, L1 to L5. This is the largest and strongest vertebrae. And this is where it bears most of the body's weight. We have the sacrum. This forms the lower portion of the back. There's 5 separate bones at birth, and they're fused together to form a single bone. We have the coccyx, also known as the tailbone, forms end of the spine, made of 4 small bones that are fused together. As you can see here, Here we have the cervical, C1 to C7. We have the thoracic, which is T1 to T12. And then we have the lumbar, L1 to L5. Here's your scrotum, and here's the coccyx, the tailbone. This is the anterior view. Next, we have the pelvis. So the pelvis protects internal organs. It supports lower extremities. The ilium then forms back and sides of the pubic bone. And the sacroiliac, looking at that term, sacrosacrum, ILI is ilium. It's articulation between the sacrum and the posterior portion of the ilium. We have the ischium. This forms lower posterior portion of the pubic bone. This bears weight on the body when sitting. We have the pubis, forms anterior portion of the pubic bone. And we have the pubic symphysis, is cartilaginous joint uniting left and right pubic bones. Okay, the next one we have, continue with the pelvis, is the acetabulum. It's a large circulatory cavity in each side of the pelvis. And this articulates with head of femur to form hip joint. So this is also known as the hip socket. And you can see here the figure here. This is the anterior view of the pelvis. We have the sacrum up here, ilium, pubis, ischium, pubic symphysis, acetabulum, and the coccyx is right here, tailbone is right here. Moving on to the legs and knees. So we have the femur. This is the largest bones in the body. Knees, patella or kneecap, popliteals behind the knee, and crucial ligaments allow movements of the knee. We have the tibia, also known as a shin bone. We have the fibula. So the tibia is the larger lower leg bone, and the fibula is the smaller of the two bones in the lower leg. Here's a figure of it. This is a lateral view of bones of the lower extremity. So we have the pelvic bones, femur, patella, it's right here. Tibia is bigger one. Fibula is a smaller bone. With the malleus, it's right down here. Tarsal bones, calcaneus, the heel bone, metatarsals, phalanges. Here's your patellar ligament, the little blue area there. So this is the lower leg bones. Ankles, these ankles are the joint connecting the lower leg and foot. They do obviously allow for movement. They're made up of 7 tarsal bones. The malleus is a rounded bony projection on the tibia and fibula on the sides of each ankle joint. We have the talus. This articulates with the tibia and fibula. Calcaneus is the heel bone, which is the largest of the tarsal bones. And here's a lateral view of the bones of the right ankle. So here's your fibula, the tibia, talus, metatarsals, phalanges, and the calcaneus, the heel bone. Next, we have the feet and toes. So you have 5 bones, the metatarsals, form part of the foot to which toes are attached. They're the phalanges, bones of toes. Great toe has 2 phalanges, other toes have 3 phalanges. Here's a superior view of the bones of the right foot. So you can see here, here's your phalanges, metatarsals, this area, tarsals, with a distal phalange, middle, proximal, talus here in the green, and the calcaneus, the heel bone. Some medical specialists related to skeletal system. So there are several out there. So we have a chiropractor, we have an orthopedic surgeon, we have an osteopath. Looking at that term, osteo is bone, path is disease. So this combines traditional forms of medical treatment and spinal manipulation, osteopath. We have a podiatrist. Looking at the term, POD is foot. Iatrist is specialist, so someone specializing in the treatment and diagnosing disorders of the foot. We have a rheumatologist. Take a look, couple more terms here. Ankylosis is loss or absence of mobility of a joint due to disease, injury, or surgical procedure. And looking at that term, we can break that down. Ankle and KLY is host is abnormal condition or disease. We have adhesive capsulitis. This is breaking this term down. Capsule, this little box. This is inflammation. So it's very painful ankylosis of the shoulder. Adhesive capsulitis. Atherosclerosis, breaking the term down. Atheros, joint. Sclerosis, abnormal hardening. So it's abnormal hardening of a joint or stiffness of joints. A Baker's cyst is a fluid-filled sac behind the knee. Bursitis, itis is inflammation, so it's inflammation of the bursa. Chondromalacia, looking at the term, chondro is cartilage, malacia is abnormal softening. So this is abnormal softening of the cartilage. Costochondritis, breaking the term down, costo is rib, chondro cartilage, itis is inflammation. So it's inflammation of the cartilage, and that connects a rib to the sternum. Costochondritis. Next, we have the pathology. The let's see if I can say this. Hallux valgus is abnormal enlargement of the joint of the base of the great toe. Next term we have is hemiarthrosis. Hem is blood. Arth is joint. Os is abnormal condition or disease. So it's blood within a joint, which is an abnormal condition. Hemiarthrosis. We have polymyalgia rheumatica. Poly is many, much. My is muscle. Algae is pain. So this is inflammatory disorder of the muscles of the joints. Sprain, the sprain is just due to wrenching or tearing of a ligament, is what sprain means. Synovitis, inflammation of the synovial membrane. This resulting in swelling and pain of affected joint. Luxation, total displacement of a bone from its joint. Subluxation is partial displacement. Arthritis is just inflammation of one or more joints. There are more than 100 types. The most commonly associated with aging is osteoarthritis. Osteo is bone. Also known as degenerative joint disease or wear and tear arthritis. We have spondylosis. Spondyle is vertebrae. Os is abnormal condition or disease. So this is a degenerative disorder causing loss of normal spinal structure and function, osteoarthritis. Gout is a type of arthritis, also known as gouty arthritis, and it usually begins in your big toe. Rheumatoid arthritis, commonly known as RA. It's a chronic autoimmune disorder attacking joints and other organs. The joints become very inflamed and thickened. They're swelled, they're painful and immobile. Can be very painful. Ankylosing spondylitis. This is a form of rheumatoid arthritis. Again, it causes inflammation of joints between the vertebrae. We have juvenile rheumatoid arthritis. Affects children ages 16 years and younger. Symptoms include stiffness, pain, joint swelling, skin rash, fever, slow growth, and fatigue. It may not continue beyond childhood. Many children do outgrow it. Spinal column then, so what does this do? It protects the spinal cord. It supports head and the body, and it consists of 26 vertebrae. We have a herniated disc. Herniated disc is a breaking apart of an intervertebral disc, resulting in pressure on spinal nerve roots. Lumbago, breaking this term down, L-U-M-B is lumbar, AGO is disease condition, so it's pain in the lumbar region of the spine. Spondylolisthesis, it's forward slipping movement of the body of one lower lumbar vertebrae or sacrum. So you can break that term down also. Listhesis is slipping, spondyle is vertebrae. Spinal bifida is a congenital defect. And they are due to a lack of nutrient folic acid during the early stage of pregnancy. So it is a congenital defect. The spinal canal fails to close completely around the spinal cord. Is what happens with spina bifida. Kyphosis, also known as humpback. Kyph is hump. Lordosis, also known as swayback. Lord is bent or backward. We have scoliosis. Scoli is curved, so it's abnormal curvature, lateral curvature of the spine. And this figure here, you can see the first one we have here is kyphosis. Then we have lordosis, and then we have scoliosis. So these are abnormal curvatures of the spine. Next, we have avascular necrosis. Breaking that term down, A is without, vascular is blood vessels, AR pertaining to, and necrosis is tissue death. So this is death of bone tissue, and this is due to insufficient blood flow. We have craniostenosis, cranial skull, stenosis, abnormal narrowing. So it's abnormal narrowing of the skull. Osteitis, osteo is bone. Itis is inflammation, so it's inflammation of the bone. Osteomalacia, malacia is softening, so this is abnormal softening of bones in adults. Osteomyelitis, osteo is bone, myelo is bone marrow, so it's inflammation of bone marrow and adjacent bone. Paget's disease, abnormal breakdown of bone, usually in pelvis, skull, spine, and legs, followed by abnormal bone formation. Periositis, inflammation of the peristeum, peri-surrounding OST is bone. Bones, continuing. Rickets is a defective bone growth in children due to lack of vitamin D. We also have short stature, which is dwarfism. Talipes is just a clubfoot. It's a congenital deformity of the foot. Primary bone cancer. So primary bone cancer originates in the bone. The secondary bone cancer metastasized to bones from other organs. The difference between the primary bone and the secondary bone. Myeloma. Myelo is bone marrow, oma is tumor, so it's tumor of the bone marrow. Osteochondroma. Osteo is bone, chondro is cartilage. So it's benign bony projection covered with cartilage. Osteochondroma. Osteoporosis. Osteo is bone, porous, small opening. Os is abnormal condition or disease. This is frequently associated with aging, osteoporosis. Osteopenia. Osteo is bone, penia is deficiency. So increases chance of developing osteoporosis. It's a thinner than average bone density. A person has osteopenia. Compression fracture, compression of the bone on itself. So these are different related fractures with osteoporosis. So you can have compression fracture, Colles fracture, osteoporotic hip fracture. So you can see there's different related fractures with osteoporosis. Moving on to fracture. So a fracture is a broken bone. It's described in terms of its complexity. So we have a closed fracture. Bone is broken, no open wound in skin. It's just a simple fracture. Then we have an open fracture where the bone is broken, open wound in the skin, also known as a compound fracture. We have a comminuted fracture. Bone is splintered. We have a green stick fracture. Bone is bent and partially broken. This is seen frequently in children. And then we have oblique fracture. This fracture is at an angle across the bone. In the next slide, we can look at the figures here of each one. So here's your green stick, incomplete, closed, simple, complete, open, compound, and then a comminuted fracture. These are just types of bone fractures. Continuing with fractures, we have pathological fracture due to weakened bone. It is not due to trauma, it's just that the bone is so weak. We have a spiral fracture due to twisting action, stress fracture due to overuse, and then transverse fracture. This transverse fracture just occurs straight across the bone. Additional terms associated with fractures, we have fat embolism. These may form with fracture of long bone. Crepitation is the other one. It's just a grating sound when ends of broken bone move together. Callus. Callus is just a bulging deposit around the area of the break. Tissue eventually becomes bone. Diagnostic procedures of skeletal system. Radiograph, which isn't just an x-ray. Arthroscopy, scopy. Arthro is joint, scopy is visual examination. So this is visual examination of a joint. And here you use a scope. Bone marrow biopsy, it's another procedure. Magnetic Renaissance imaging, just MRI. Ultrasound bone density testing can be done. A dual X-ray, DXA, can also be done, just measures the bone density. You can have a bone marrow transplant, treats cancers that affect bone marrow. There are a couple different kinds, allogenic bone marrow transplant and autologous bone marrow transplant. We have the orthotic, and then also the prosthesis. This obviously substitutes for a disease or missing body part. Arthrodesis, let's take a look at this. It's one of the joints here. Arthros, joint, desis is to bind, tie together. So this is a surgical fusion of two bones. Arthrolysis is surgical loosening of ankylosed joint. Arthrojoint lysis is loosening or setting free. Arthroscopic surgery is just a minimal invasive procedure for treating inferior joint. We have chondroplasty, chondrocartilage plasty surgical repair, such as the surgical repair of a damaged cartilage. Synovectomy, is synovial membrane, ectomy is surgical removal. So that surgical removal of synovial membrane, and then it's Roman point. Joint replacements, so we have the total knee replacement, which all parts of the knee are replaced. We have a partial knee replacement, only part of the knee is replaced. Then we have a total hip replacement. With this procedure, it restores damaged hip to full function. We have a hip resurfacing. They just place of a metal cap over the head of the femur to restore function of the hip. And then we have a revision surgery. It's replacement of a worn or failed implant. So if you've already had surgery and it either wore out or it failed, you can go back in for revision of that replacement. Next, they talk a little bit about the spinal column. Some of the procedures: percutaneous discectomy, percutaneous vertebroplasty. Looking at that term, vertebral is vertebrae, plasty is surgical repair, so it's surgical repair of the vertebrae. The discectomy, then, it's a ruptured disc. This is just suctioned out with a laser. Laminectomy is another surgical removal of posterior portion of the vertebrae. We have spinal infusion, immobilization of spine by fusing two or more vertebrae. We have craniectomy, underneath the bones. Crani is skull, ectomy is surgical removal, so surgical removal portion of the skull. Craniotomy, crani is skull, tomy is surgical excision, so it's surgical excision or opening of the skull. And then we have cranioplasty, plasty surgical repair, so surgical repair of the skull. Osteoclasis, osteobone, clasis is to break, so surgical fixation of a bone to correct deformity. Osteectomy, just a surgical removal of a bone. Osteoraphy, surgical suturing of bones. Raphy is surgical suturing, is what that means. Osteotomy, surgical cutting of a bone. Periostomy, perio is surrounding, so incision through the periosteum to the bone. So treatment of fractures, they can have a closed reduction, where they're manipulating and realigning fracture bone or joint dislocation. They can have an open reduction. This is a surgical procedure. If closed reduction is not practical, then we'll go ahead and do the open reduction. Immobilization, holding, suturing, or fastening bone to fixed position with strapping or cast. And then we have traction. This is pulling of a limb in distal direction in an attempt to return bone joint to normal alignment. Traction. External fixation, use of external device, I should say, to hold a piece of bone firmly in place during healing. And then we have the internal fixation. They place plates and pins directly into the bone to hold the broken pieces in place. So we have external and internal. And that is it for the chapter PowerPoint. So please go to the workbook and complete the exercise for this chapter. You have quite a few different exercises out there to complete. Okay, thank you. Thanks everybody for watching.